Hello, I am Arnaldo Colombo, an infectious disease specialist and a professor of medicine at the Federal University of São Paulo, where I run a lab for fungal diagnosis, where I train people and I conduct lots of research in the epidemiology of fungal infection in Brazil and Latin America. The scenario of fungal infection in Brazil and in South America is very challenging. We have a huge occurrence of endemic mycosis, mainly viral mycosis and histoplasmosis. We have lots of people with mycosis of implantation, as well as patients who develop opportunistic fungal infection, mainly cryptococcosis, candidiasis, aspergillosis, and fusarium. And unfortunately, we don't have good lab support for the early diagnosis of those infections, as well as the drugs for treating those patients. The consequence is that besides the high occurrence of those infections, we have lots of death related to those infections. Life is very important for Brazil and South America in order to provide programs for medical education, for training people to work in lab support for the early diagnosis of fungal infection. It's important also to provide conditions to organize multi-center study to characterize the burden of fungal infection, to understand populations that are susceptible, and to help us to make the society to understand that fungal infection really a challenge. It is a public problem that should be addressed by the government.